Hi, everybody. Good afternoon, good evening, and good morning, wherever you are. Thank you very much for joining the Boardroom Club today to our Unicorn Conference featuring an executive from top tech companies worth over $100 billion. My name is Yossi Garmazi, second year MBA here at Cornell University, and I'm joined here also by my classmates, Megan Shkolyar. Megan.
Hi, everyone. My name is Megan Shkolyar, and I'm also second year MBA alongside Yossi. Super excited to have the opportunity to interview Kira today.
Yeah, definitely. So today we are fortunate enough to interview none other than Kira Radinsky, who is the founder and CEO in Diagnostic Robotics. You're also one of the most famous scientists came out of Israel. So Kira, thank you very much for joining us today.
Well, glad to be here.
Yeah, so we thought about asking you a few questions about your previous experience, about your work experience as well, and then moving on to a few quick Q&A section with questions submitted in advance from the audience. Sounds good?
Perfect.
Yes. So, Kira, we wonder if you can tell us a bit about your academic journey. I mean, you studied for the first bachelor degree in computer science at the Technion, one of the most famous institution in Israel, and then you decided to continue with PhD in computer science. What attracted you in the first place to the field, and what kept you there for pursuing also your PhD?
All right. So I think all of my fascination in predictions is starting really early age. So my story cannot be told without telling the story of my family. So I wasn't born in Israel. I was born in USSR. Just to give you a little bit of background, what it means to live in USSR in the 80s and 90s. In the 80s, if you were Jewish, you were not allowed to study in any university. They had a cap on how many Jews can get accepted for each university. For example, in the University of Kiev, the city I was born in, only one Jewish person can get accepted every year. You couldn't go and work in whatever you wanted. You had to be part of the Communist Party. If you don't want to be part of the Communist Party, there's more than one job that is actually not available for you. When you go to the library, you see from they look at your nationality in your passport or ID card to know which books you can and cannot take. And as always in communism, people get paid pretty much all the same. Unless you're a factory worker, you get paid the most, but everybody else get paid pretty much the same. And one day, as you probably all know, the nuclear reactor exploded. And the way the party decided to deal with it is tell nobody. So the way most people found out is they were listening to the Norway radio. Norway was complaining that those Ukrainians are radiating them. What's going on? My mom was pregnant with me. And she didn't quite know what to do. There was no public announcement, nothing on a national level. And everybody was waiting to see what the president of Ukraine will do because he had grandchildren in school. And then one day his grandchild did not come to school. My mom was giving math lessons. My mom was an engineer. She was giving math lessons after work. And one time, one of her students comes back and he says, I won't come to more lessons. My mom is a nurse. She checked. I'm already active. I'm leaving to Moscow. My mom and another friend of her, both pregnant, took, I think, literally one of the last trains that was allowed outside of Kiev to leave, specifically they went to Russia. The way she describes the situation, she was standing in a train station. Again, I'm talking about the 80s, right? She's standing in a train station and random people come with their children and ask, would she mind taking their children with her? So she left Ukraine with additional 3 kids, which were not hers, with phone numbers that she can actually call. And she has an entire journey about, I don't know if you know, but you couldn't just take a hotel. Hotels are for diplomats. So you arrive to a new place, where do you stay? So she has a huge story about how she moves from one place to another, each time with a different arrangement. But nevertheless, she had to give birth in Kiev. She gave birth in Kiev, where I was born. All food ran out because of the radiation. And the way Russia was managing the empires, all food first comes to Russia, and then whatever is left comes to the other countries. So in other words, all food ran out. And in around till 89, nobody was allowed to leave. I think it was one of the only countries you need a visa to leave instead of coming in. So pretty much everybody was stuck. And then in around 89, USSR started falling apart, and there was a lot of pressure coming in from the Jewish community in the United States and in Israel saying, well, at least let the Jews leave. Why not? We'll pay you. And the Jewish population was the first allowed to leave. The national announcement was they were never citizens to begin with, so why not? In order to leave, you have to quit your job and then wait for a visa around 6 to 9 months. Remember, most people don't have savings because you get paid a similar amount to everybody. So everybody has exactly the same amount, and you need to pay a fine. And there's the catch. It's illegal to be unemployed. So at every portion of the 6 to 9 months, you can get arrested. So my mom had to predict when to come to Israel. The reason she had to predict, everybody knew the Gulf War is going to start. It wasn't a big surprise. Everybody heard it in the news. And I think it's just a bad experience to come to a place where just the war started. So she had to predict almost 9 months in advance when to come to Israel in order to apply for a visa. Mom got it almost right. But instead of coming 2 weeks before the war, or after the war, we came 2 weeks before. So that's pretty much my first memory as a 4-year-old in Israel, is that we had to sit in a closed shelter with gas masks being attacked by Iraq in the Gulf War. But in any case, I knew that at some point, this was my childhood dream. I'm going to become a scientist. What type of scientist? I didn't know which. Many years I was thinking about going into healthcare. I was really intrigued by that. I would actually look for surgeries on television. And when I was 14, I heard there was a summer camp at the Technion where you can join PhD students and help them with their studies. So I selected a research study called, the topic was how natural compounds impact the proliferation of prostate cancer cells. As you can guess, I did not select the research topic. This is like pretty much from a list. It was a really interesting one. You had to study how broccoli or eating broccoli in really large amounts impacts prostate cancer. By the way, if you're interested about the result, if you eat a lot of broccoli, like tons of broccoli, it will kill cancer cells. It kills other cells as well. But if you eat it in kilograms every day, okay, it will kill also the cancer cells. And one of the jobs that we had there, I had to feed those cancer cells like every day with broccoli and see the impact. But the job was one thing, you were not supposed to touch the cancer cells with the pipette. If you touch it, you can get infection. Who knew those cancer cells die so quickly? Well, of course, after 2 weeks at the lab, I infected pretty much all of the cancer cells. I didn't notice. I touched it by mistake. I hope nobody's going to notice. And therefore, I was put on analytics. It's like, well, you got to count how many cancer cells are left every day, which is 50,000 cells, pretty much. And then we'll see if it impacts or not. And I think this was the first time, again, this was very early time for a lot of those AI algorithms. And I built my first image processing algorithm we got like from a microscope, a picture of the cells. And then the system counted it because I didn't want to do it manually. I want to go to the pool. And this is where I understood that if I'm going to become a scientist, I'm going to become a different type of scientist. I'm going to become a scientist who's actually automating myself. I'm not going to be working in a lab. I don't have a skill for that. And I want to build tools that actually push science forward in 10 times faster speed. When I started I started my bachelor's when I was 15, mostly focusing on computer science because I understood that's going to be the future in science and pushing me as a scientist forward. And I was in this program where you could start your PhD while doing your bachelor's. And I was really fascinated by neural networks, inspired by anything to do with AI and how it can actually mimic parts of the brains, and specifically natural language processing. And I came back to my earlier dream. Well, how can we build a scientific system to predict future events? So the way I built that system at that time, I had access to 150 years of news articles. Like I literally mined them from the web, like from the New York Times. Most of them were images that you had to do OCRs on. It was that early days. And I started building a natural language processing system that reads those phrases from different articles, identifies who did action, what was done on, when, etc. Identify words like causes, because, after, so I could know if an event caused another one. And I built a graph of 300 million nodes and billions of edges, representing everything humanity knew in the last 150 years. And I started using this graph in order to predict future events, right? So the type of future events at that time, I was doing an internship at Microsoft. So it's a very long-term internship. I've worked at Microsoft for 3 years. I was working in the search engine group. In other words, we're building the algorithm. So you can guess how long ago that was, that we're actually building an algorithm for search. But in parallel, I was working with the Gates Foundation. And they were asking, can you use this causality graph to predict something useful? I was like, well, like what? There's like, well, predict an Ebola outbreak. And it turned out that we had the entire pattern. You can actually walk on the graph. And all Ebola outbreaks that we had in our data started from the same place. When people are becoming greedy and looking for diamonds and gold. So when you look for diamonds and gold, it causes deforestation. We had it in the graph. When deforestation happens, it causes animal to migrate, but specifically bats. And if somebody eats an uncooked bat bushmeat, it causes most of the Ebola outbreaks. So this is pretty much what it got me to understanding that maybe we can start mining more of those events and maybe additionally correlations and not just causations and building predictions. And this is where I pretty much decided that, like this is not something you do on the side. You actually need to build an entire PhD on it. And most of my PhD was about how we take all of those news articles, social media, searches that we have online and predict future events. Now, my first success, which was something I was extremely proud of when we predicted the first cholera outbreak in Cuba. So working with the Gates, they were extremely interested in cholera. Why? Cholera is killing almost 100,000 people every year. But if you get clean water in time, you reduce mortality rates from 50% to less than 1. So all they need to do is predict when it's going to happen and send clean water. And our system identified the following pattern. If you have a drought and 2 years later, you have a storm or a flood, the probability of those floods causing cholera in certain locations is super high. And it identified this for Cuba. So Cuba did not experience any cholera outbreaks for 130 years at that time. So our prediction was actually not accepted well. And we're like kind of ignored it. We're still developing the system. But 2 years later, when it found the second step of the prediction that there's floods coming in next to Cuba, they actually did send some of the clean water in time. And indeed, it was the first cholera outbreak in Cuba in 130 years. So for me, this was pretty much the journey, like I was fascinated about, that was like my childhood dream to become a scientist. I understood that I'm not going to be the regular scientist you see on TV who actually work in a lab, cure people, actually do stuff. I understood that I'm really good in the analytics piece. I'll probably be an analytics scientist I didn't even know the name of. And I've kind of started combining them and my passion for healthcare into building population health systems.
That was fascinating, Kira. And following on that, so your first company actually that you founded is SalesPredict, was kind of like using AI at times when AI wasn't the thing, the technology was. At least nobody talks about it as much as they do now. Can you share with us like some of the obstacles when you, let's say, approach some of the investors and say, oh, I know how to predict the sales and so on, and what led at the end of the day to be acquired by eBay?
Yeah. So I had a lot of experience already in Microsoft building AI systems, both the algorithmic part on the search engine, but a lot of practical one that we're doing in the population health space. And I said, well, I want to become an entrepreneur. Why? My husband was an entrepreneur. And he said, well, if I can do it, you can do it too. I said, you know what? Yeah, why not? Let's try. And my vision was, can we take like all of these macroeconomic events that are happening? Think about it as like almost like analysts on steroids, reads every piece of news article and tries to predict an event. I was inspired by a specific prediction my system made. We were able to predict that iPad prices will go up in the United States. The pattern that the system identified was there's going to be a tsunami in Japan. It saw a tsunami in Japan. It said it's going to hit factories on the shore that are producing the chips that are then sent to a factory in China. Then it predicted there's going to be a shortage of iPads. And when you have a shortage, prices go up. And I said, well, this is so cool. If we can do it in scale, you can make like really awesome predictions on the macro level for most companies. So our value prop, we started approaching companies. I specifically focused on B2B companies. And we asked, can we have access to your historical data of sales? Mostly access to Salesforce. We would extract previous leads who converted or like or customers who were upselling, and layer on top of this information we would find online and all of this macroeconomic infrastructure that we had. The value for those B2B companies, we would predict who's going to upsell, who's going to churn, which lead's going to convert. We're able to triple their conversion rates, which was pretty awesome at that time. But behind the scenes, we started having very valuable data. We had data about both private and public companies, about who's selling to whom. And literally before the sales results are already public, we already had access to it. Not because we predicted, literally this was the data that we were working on. We got to almost like 100 customers. The company didn't, after 3 years, we were acquired by eBay. So eBay has a very successful B2B business. You'd be surprised. A lot of small businesses where they get percentages from how much sales is done on their platform. So they wanted to encourage more B2B businesses to build relationships and sell together. And I started building the infrastructure using what we build in SalesPredict for combining those businesses. And we were able to increase by almost almost like $700 million per year of additional revenue coming into eBay from additional interactions done on the platform.
That's fascinating, Kira, and it's amazing how you use AI back in the time. And kind of like maybe a follow-up, your next company is Diagnostic Robotics, which now you are in the CEO and CTO of the company. So I was just wondering, this transition from doing more like business side of B2B or B2C, even like with company in SalesPredict, you move to Diagnostic Robotics, which is more about the intersection of AI and healthcare. What led you to this transition to found another company in another area, and how the products evolve over time?
Yeah, well, actually, it also comes back, like after I worked a lot in commerce, I said, like, I want to go back to what I wanted to do when I was younger, right? I think I had the luxury after selling my previous company of actually doing more, well, taking higher risks, right? And I said, like, I want to go to healthcare. If I could give you anybody advice here, don't go to healthcare. Healthcare is extremely hard to monetize, extremely hard, right? And it's not a technology business, so just don't do it. I wish somebody would have told me and I would have believed them. But I decided to take that risk almost 5 years ago, and I started Diagnostic Robotics with another professor in my university. Don't get scared by the name. We're not doing neither diagnostic nor robotics. It's just like the acronym is DR. It's just like a really cool name. So I started working with health plans in the United States. So large ones, you know, like Elevance, different Blues. We had access to 60 billion claims, 60 billion interactions of patients with physicians. And what I wanted to do is get into proactive care. Why? You know, there's those stats that showing that till 2030, we're going to have almost 4 billion people on Earth without access to primary care. What does that mean? It means the emergency line is going to actually be, if today it's 3 hours, we're going to be waiting 8 hours and more, because all of those people will go to the hospitals like they do today in China. It's not even a prediction. It's already happening. And I was thinking, well, what's the best way of preventing it? It's maybe we can prevent them from being sick. Right. So health plans actually love that, because if patients are not sick, they pay less money. Right. So they have care management teams, specifically nurses, whose job is to call patients up and say, well, we've identified that you're deteriorating and try to find some clinical solutions. How did they do it before we entered the market? Well, literally, they would call the most expensive patients and tell them, I don't know, do a diet, stop smoking. You can guess how hard it is to call somebody who has CHF for 50 years and tell them it's like, oh, you should stop smoking. It's like, yeah, I know. Okay. Or eat better. And it's like, I don't have money. Or like, take your medications. Like, I don't read. Right. So very basic challenges. And what we started doing is, instead of predicting who is expensive, which is almost trivial, we would predict who will be expensive and apply causal inference to identify, is there even anything you can do that will prevent it? Because most of the patients are too far along. Like, you're not going to call somebody who has like 15 years, already has all of those diseases. There's almost nothing you can do at that point. So it was a paradigm shift for that period of time. And we started building a framework where it's almost like a management framework, where we tell care managers, which is nurses, exactly which patients to focus on and what's the best clinical next step. With time, there was a big push in the healthcare field into value-based care. In 2 words, today, most physicians are paid fee-for-service, meaning you come to a physician, he gets paid. No incentives to make you feel better. Well, why would you feel better? It decreases my business, right? Again, I'm saying this very cynically. It's not exactly how they're thinking, but there's no built-in incentives in healthcare, well, at least not a few years ago, to make physicians care about what happens after the meeting with them. So the CMS, think about it as like the Ministry of Health, started changing the incentive design in a way that they will pay physician a fixed fee per patient per month, depending on their diseases. If the patient is healthy, awesome, you made tons of money. If they're not, it's coming out of your pocket. Nobody else is going to pay. And they pushed it for Medicare. And with time, all of the health plans started pushing those type of contracts onto the provider fields. Till 2030, we're going to have 100% of Medicare patients under value-based care contracts. For me, it was a huge change of what we're doing, because now we should, instead of working on the health plan side, we started pushing more and more to work with the providers, with the actual primary care physicians. And we started building almost like a workflow system for primary care physicians to know what's the best clinical next step to do with the patient. And then what we identified, what was our biggest challenge? They say like, this is awesome. You tell me to call all those patients and ask them to take their medications. I don't have time. I don't have staff. All my nurses quit. They moved to somebody else. The PE, the private equities bought them, gave them high salaries. I cannot even afford like the day-to-day. I'm overburdened. I have no time. So this is where we started actually building what we call care management bots. A lot of the work of a medical assistant is calling a patient and scheduling a meeting, reminding them to take medications, if not, scheduling a meeting with a primary care physician to explain them that they need to do it. And think about like how hard it is to get somebody online. Like it's just like calling them up and getting an answer. To be honest, even patients is a smaller portion. The bigger portion is calling all of those back offices. Sometimes you need to call a specialist to make sure that they will take your patient as a referral. So you call another medical assistant, trying to get them online to convince them to do a scheduling. Another one, you need to call the pharmacy. You need to call, let's say, Walgreens, and make sure that the drug you prescribe the patient is actually there. If not, you need to prescribe something else. Who's going to do all of this? Care management bots. So we started taking all of those generative AI advances, which was, again, you all know them, you've all been seeing, but they actually have a really nice voice, and calling all of those back offices and automating some of the next steps that we ourselves are actually recommending. So today we're treating almost 28 million patients monthly, are going through the system. We're getting to a point where we're improving the amount of patients treated by the primary care physicians by 20%. And for most of them, we still did not deploy the bots. So right now we're going to, all of this is just by applying next steps, creating standardization. And the bots, I think, is going to be the next frontier where you actually finally start sharing data in this ecosystem. So we couldn't solve this by having a unified electronic medical record. Super hard to do it in a scale of the United States, but maybe having bots talking to bots and transferring information, that's what's going to bring the biggest change in healthcare.
That's fascinating, Kira, again. And maybe last question for myself before we moving on to Megan's question. So we talked a lot about AI, and one of our previous speakers in the Israel Tech Conference we did back in March was Shai David from Retrain AI, and we spoke about all the things with AI and HR and all of the biases that's going on with it. So we were just wondering if you can tell us a bit more about maybe a bias in information, specifically in healthcare, and how you deal with it as the CEO and CTO of the company.
Yeah. So I'm going to quote somebody else's work and then going to tell you something I think much cooler than bias. So there was a very nice study in, if I'm not mistaken, it was in Science in 2019. Researchers took an algorithm coming out of Optum, which is part of United, which what it was doing, it was ranking patients for proactive care. That's what it was doing pretty much. And they noticed that it's discriminating against the Afro-American community. How come? How did it work? Eventually, part of the features that are going into the algorithm is how much the patient costs, right? Makes sense. Expensive patients will be expensive next year as well, right? It's like no surprise here. And historically, the Afro-American community did not use the healthcare system enough because they did not have access to it. Okay, worse insurance or worse areas they live in, again, like on an aggregate. So the algorithm understood that they're going to be less expensive. Therefore, it is not serving the needs of the health plan, therefore prioritizing lower for this, even if they have the same diseases, they will get less proactive care as well. So this was a very interesting study that was done, and they were publishing and like created a lot of changes in the health plan community where they actually started checking those algorithms for bias and whether it's biasing against a certain subpopulation or not. The second piece that I've noticed, especially for us, so we do all of those bias checks, making sure that we're not biasing against certain communities, that looking at all the rankings, there's no big difference for people who have the same diseases in the ranking order. What we did start noticing is something else which we don't talk enough, is empathy. And I want to read to you, let's say if I have it open. It's funny where the actual bias system performs non-empathy to humans. So at some point, this is a real quote. Our bot would call a patient and say, I understand that you're going through a tough time, but it's important to remember that others have it worse. Count your blessings and try to focus on the positive. Here's another one. I can see where you're upset, but you need to toughen up and stop dwelling on it. Life is tough and you just have to go and get through it. Now, why did it happen? Because historically, this is how those algorithms were trained. We did not train them on real calls. And with time, we had to tune them more and more on real calls coming in from care managers using our system. So one of the things that people, I think, dismiss and don't measure enough, so everybody talks about bias, not enough people talk about empathy of those algorithms, especially when you have human to machine interaction.
Again, fascinating and very inspiring indeed, Kira. So yeah, without further ado, Megan, the floor is yours.
No, Kira, thank you. So interesting also hearing about your family story. My family has a very similar story, also from USSR, also from Kiev. So just fascinating. But yeah, kind of just switching to another company that you're a co-founder of, Nano. So could you tell us a little bit more about that company and product?
Of course. So I guess everybody remembers mRNA from the COVID vaccine. In general, what is mRNA? mRNA is like a message that if you deliver to a cell, the cell will produce a protein. Now, there's a lot of disease related to the fact that there's usually some DNA deficiency that does not produce the right protein. It creates a lot of diseases. Even if you don't, all your DNA is fine, it will be still awesome for some cells to produce a protein like we saw in the COVID vaccine. What's the problem? So what's the problem is how do you get the mRNA to the specific cell that you want to produce the protein? Because if the problem is in the lungs, the fact that my liver will produce this protein is not going to help me. So the problem we're trying to fix is what's called mRNA delivery. In a metaphor, think about mRNA as an astronaut, and we're building the spaceships. So we need to get a spaceships of mRNA to the brain, to the lung cells, only to T cells, for example. So how did this industry work till today? First of all, just as a statistics, in the COVID vaccine, the actual mRNA took 2 days to develop. It's almost trivial. Hard to produce in scale. Pfizer did an amazing job, and other companies as well. The question was, how did they develop the mechanism of delivery? The mechanism of delivery, they were super lucky. Somebody developed it for 20 years almost. So this is insane how long it took. And historically, the way mRNA was delivered is through viruses. You take a virus. Viruses had hundreds of millions of years to find a way to get to the brain, for example. You take the virus to find a way. You take out the DNA, which is usually inside the virus, put whatever you want in, and you send it. What's the problem with this approach? Well, the body doesn't like viruses. It kills itself, right? So that's the reason that mRNA treatments were pretty much blocked and did not pass FDA for so many years till the COVID vaccine, because the first patients who were treated through virus treatments, and those patients died from the viruses, not even from the mRNA. So all of this field was stuck for 15 years. So what we're trying to do is not use viruses, but get inspired by viruses, but use it by fats. What does it mean? I want to build a spaceship from a fat. Why? Because, body loves fat. This is something that it never kills. And the question the chemists were asking me is, well, what's the recipe? What's the formulation? So I met another professor in chemistry. We met for coffee. He told me the story. I said, oh, this is fascinating. Well, why are you asking me? I'm an AI person. It's like, do your fat stuff, right? It's like, I don't know how to help you. And he tells me, can we use AI to copy those things that the viruses did and put it in fats? So well, if you know the mechanism, do it yourself. Why do you need me? It's like, I have no idea what the viruses did. We have no clue. We just know that some materials got there, some materials did not get there, and we don't know the difference. It's like, oh, this is interesting. Exactly good for AI. So what we started doing, and we built a company called Nano, that AI produces a recipe for how to connect different forms of fats. More specifically, it's called LNPs, lipid nanoparticles, in a way that it will get to a specific cell without toxicity. So there's a lot of stuff. You don't want toxicity, you don't want the other white cells to go crazy when it sees it, and etc. And you don't want it to ruin the mRNA while doing so. So we started this company more in an academic venture at first. We got to initial results for mice. We're both professors, so both of us are the inventors. We got connected with two amazing entrepreneurs who built a company out of it. It was invested by NFX and Andreessen Horowitz, and since then, they reached the lungs, which is extremely amazing, getting from literally a vaccine, right? Think about you inject from the blood cell and get to the lungs, because lungs don't like getting stuff from the blood. They usually, take it from the air, right? So lungs, cartilage, liver, and more recently, T cells. Now, T cells is something I'm extremely excited about. T cells think about it as almost a white cell. And if you get the right mRNA in, you make the T cell develop like a protein on its head. Why do we need this head? You can produce it in a way that it will identify cancer cells. Certain cancer cells have specific proteins that they develop. And if you teach the mRNA to get the T cells to develop it, your own immune system can actually identify cancer cells. So by the way, we all have cancer cells all the time. Just the immune system knows how to identify and eat it. Okay. What happens in cancer? They almost develop this invisibility cloth. So you cannot see it. And this invisibility cloth has several characteristics, which most, again, I wouldn't say most, but many cancer tumors have it. And the problem is, how do you get the T cells to do it? So right now, there's many forms of biological treatments and others that you pretty much like takes those cells out in a lab. You manually fix it to produce those proteins. It's super hard to do it. You need a scale, right? You need all T cells to do it, right? Not just one or two. So it's super hard and super expensive. Here we're talking about something you can inject once. No chemo, no nothing. You inject once. Your own T cells develop kind of the recipe on how to identify, remove the invisibility cloth, and can attack it. So right now, most of the experiments are in monkey phases. So the lungs already passed the ape experiments. They're going to do another one. The T cells is going to go into additional monkey experiments and then almost directly to humans if we are going to identify that it's not toxic. So this is pretty exciting. This is the kind of stuff that makes me happy, like waking up in the morning.
Kind of stuff you dreamed about as a kid.
Yeah, pretty much, right? And it's pretty, like every time something works, I tell them it's like, I still can't believe that this AI thing works. I truly tell it because I worked with AI for a long period of time. So who knew that it works, right? No, seriously, I'm surprised every time.
Yeah. And so how do you think AI will impact nanotechnology?
Oh, wow, this is super broad, but I'll tell you what I'm excited about these days, right? Especially synthesis. So very kind of generic explanation of how chemistry works for the very last years. Let's say you want to develop a component, let's say a material, let's say, I don't know, gold. Okay. The question chemists are asking themselves, what do I have in the lab? Throw an enzyme in, like they usually know which enzymes. It eats most of it till it produces pure gold. Okay, perfect. The problem, it takes tons of time, so nobody does it. So instead, they do what's called chemical synthesis. They take materials, maybe 70% of what you wanted is produced. The rest is usually toxic, and then you have to throw it somewhere, right? And this is where you have most of the pollution and stuff we're talking about. And the question they asked, this is, in my opinion, if somebody solves this, and this is almost like a Nobel Prize worthy invention, is how do you combine those two approaches of enzymes and chemical synthesis in order to produce more pure components at the end? So you're asking me how AI is going to impact? I heard somebody say it, and I was really impressed because I completely agree with this. A person, he just got the Turing Award, and in his speech, he said, in my opinion, AI is going to win the next Nobel Prize in chemistry. So I want to be involved in somehow seeing this AI get the next invention. I'm still a big believer in the synthesis space, but I'm pretty sure there's additional spaces where it can come in.
Yeah, that makes sense. And kind of going back to Monobio, so I imagine there's a lot of healthcare data that you needed to have access to, or maybe like data from patients. Is there any, like, how were the hospitals willing to kind of cooperate with you? How did you work with them? And what was that partnership process like?
So Monobio does not work with hospitals. So what we needed to do is take all of the literature available and try to identify what reached what organ or type of cell. Unfortunately, and this is very unfortunate, is all those chemists are writing papers for themselves and not for an AI to read. So you need to look at their papers. They have like pictures of mice and colors. I was like, what am I going to do with that? Seriously, it doesn't even have like how glowing it is. Like they don't have the numbers even inside. So what we needed to do is like almost image processing and identify how red it is to identify whether it was expressed or not. They have tables. All the tables are images. You need to do image processing to extract the actual numbers from the graph. So we had to do all of those tools to even get the data. Now we have to do it semi-manually because the type of data is super important for us. So we have, chemists who are using those tools, verifying them, and creating training sets. We then have an AI algorithm who works in an active learning manner. In other words, it sends to the lab what it wants it to develop. Even if it don't think it's going to reach a certain cell, we need it for training. So there's like certain areas that we didn't get enough from the literature. You know, all those scientists are all studying like under like it's usually called like a flashlight, right? Nobody goes around it because you want a discovery. So nobody does a lot of random studies. So there's entire pieces of the universe that we never studied, we don't have information on. So for this, we have our own lab. They produce data for us. We have the literature lab. And again, if any of you will ever be in a chemistry world, please produce data which is structured so we can actually use it. This will make everybody's lives much easier. And the next problem is nobody's reporting negative results. Like no negative results, how can we tune our algorithms? So that's a huge problem, and we're still working on all of those. Now, once you develop it and you verify this on, first of all, you do verifications on cells, then you do verification on mice, and then once a year, we're like in a huge queue to do a monkey experiment. So we're waiting in this queue because all of the appointments were taken by the big pharma. They took like everybody, like you go to Poland, they already took most of the appointments. Okay, so we're waiting in line to get for our turn. Sometimes they cancel some of them, and then we get like faster in line. So this is still a huge problem. Now, with regard to hospitals, they have researchers. Those researchers are developing new form of mRNAs. So for example, in T cells. So what we do, we see ourselves as a platform, like spaceship platform, right? I don't develop the mRNA, the therapeutical area. Somebody else needs to develop. So we partner with hospital researchers who develop mRNAs, like therapeutical mRNAs, and they just need the delivery mechanism. So right now we have a collaboration with a hospital that exactly does this for T cells. And then we're gonna move to clinical experiments with, usually it's like stage 4 cancer patients, right? After we finish the monkey experiments, and then you can actually test it. After you do a very small clinical experiment, usually it moves to the pharma space. So pharma usually puts $1 billion for like very wide clinical trials, starts to pay like some milestone money for those companies. This is how we build the business model.
Yeah, that makes sense. And so, in the last few minutes, going to shift the topic of conversation a little bit. So you were recognized by Forbes and MIT Tech Review as someone to watch out in their list of 30 under 30. Did that change your life at all? And kind of sign up, get any free merch from MIT?
No, it didn't change my life. I won't lie, but it's just another feather that you can put in like your crown, right? But I did tell you what did change it, but it was many years ago and had nothing to do with Forbes. So when I was building SalesPredict, I was at company. I just finished my PhD. Nobody knew who I was. I had like a couple of really nice papers. The cholera prediction was still going on. Like we're alerted. They started saying clean water, but it wasn't well known. Like, and one day my university calls me up. I was still fundraising, right, for seed. And nobody wanted to put money. It sounds like very weird. You're going to predict economic events. If you can do it, build an algo trading company. You wouldn't believe the type of feedback we would get at that point. And my university wanted one of the newspapers to interview a researcher that can explain in a coherent way what they're doing. And mine was very catchy, predict events, very easy to explain, right? You don't need a lot of background. And I met with one of the reporters. Well, I was in the airport. I was about to fly to New York for like fundraising event. Like I met with them in the airport. And it was supposed to be like a small piece in the newspaper. Like small, I'm talking about like 100 words, right? Maybe 500, right? At some point. And so we're doing an interview, and then I fly. When I get to New York, she texts me and she says, you know what, my editor was so excited. We're going to put you on the cover page. And I was like, on the cover page? And I still have that image of me and Miley Cyrus. We were both on the cover page. I was like, this was my moment of fame with Miley Cyrus. But for me, this did create kind of a snowball effect, right? Because somebody saw that paper, somebody else wanted to interview into another one. And I'm telling you, from a situation where for a year we couldn't fundraise, we raised $5 million in 2 months, right? And since then, it's like, okay, you get published here, then another one wants to interview, you get more attention. Okay. And then it did help me create a lot of the credibility, I would say. And it's funny, it was like a very small thing that happened, me willing to interview on my way to the airport.
Yeah. Wow. And then I guess kind of following, what advice would you give to the younger generation who's just starting their path in CS?
So I'll tell what I tell my PhD students, right? I think that usually what prevents people from doing really big things is fear, right? So my trick is the following. Imagine jumping off a cliff. You'll be surprised how quickly you build yourself a parachute, because when you have no other choice, you're very creative. You'll find a way, okay? The problem is most of us are not in a situation where they're already off the cliff. It's like you can still decide not to go. Maybe you can buy the parachute, maybe the plane, maybe we can do something else. So what I usually do with my students, like I help them jump off the cliff without noticing. And then like when they're already on the air, it's like, you have no choice, right? It's either by submitting a paper, which is half done. It's like, listen, you already submitted it. It's like, that's it. You're done. That's your PhD topic. You're working on it, right? A lot of my PhD students don't want to start. They say like, oh, big ones are trying it. IBM is doing this. Google is doing this. I'm like, it's like, I usually don't tell them that it's a tough question. I tell them it's like, oh, it's very simple. I would give it even as a homework. Try it out for next week. Like try to do like the first few steps. Just reduce like a lot of your fears. Do the first step without thinking. Like put yourself in a place where it's like either that or nothing, because otherwise it's really hard to get yourself to do something amazing. Because when you always have like something else that you can do, right, you're always going to go on the safe path. And I think you're at a point, and especially when you're starting your journey, it's taking a risk and failing. It's actually a good thing, right? I met cultures, especially like in Germany and Europe, like if you fail once, it's like, it's such a huge thing. It's you bring like a huge bad vibe to your family. Here's like, we're all entrepreneurs, right? Especially you're all starting your path. Failing is part of the process. You don't fail, you find 10,000 paths that don't work. And even more than this, next time you fundraise, you're more experienced. People don't look at this as failures. It's just like part of your building expertise.
Yeah, no, that's great advice. But thank you, Kira. Thanks so much for, jumping on the call with us and sharing about your experience. And I'll pass it back to Yossi.
Yeah, so Kira, thank you very much again for answering my message back then. It was super nice of you, and we learned from you a lot. And so thank you very much again. And for everybody else in the call, so tune in for the next calls. We have, I think, next Friday with Yaron Galai, the chairman and founder of Outbrain, and later on also with SolarEdge CEO and Minute Media CEO, and even Lemonade at the end. So thank you very much, Kira, and thank you for everybody who joined us.